Good evening and welcome to Live United. Live United is an opportunity to share some of the resources and services and volunteer advocacy efforts going on here in the Monadnock region that make a difference in the lives of our citizens. I'm fortunate today to have Sarah Burke joining me in a little bit to talk about the WIC program, which really is the Women, Infants, and Children's program, both a national program and a local effort that goes on serving our families. We're going to introduce WIC through a 40th anniversary video that tells a little bit more about the program, and then Sarah will be joining us to talk about local efforts and what they mean and how they impact people who live here in the Monadnock region. So please take a moment to enjoy the information about WIC at the national level, and then stay with us as we talk with Sarah Burke from Southwestern Community Services as she highlights the WIC efforts here in the Monadnock region. So Sarah, thank you for joining us from Southwestern Community Services and the WIC program. And I'm going to use WIC because Women, Infants, and Children is such a mouthful.
It is.
So thank you for being here.
Thank
you. You know, folks just had a chance to see a little bit about the program. Tell us what it means here in the Monadnock region and a little bit of the history of WIC here in the region.
WIC was actually started in New Hampshire by Southwestern Community Services. Bill Marcello was a big impact on getting WIC to New Hampshire. It started in 1979 in New Hampshire, 1974 nationally as the Special Supplemental Nutrition Program for Women, Infants, and Children. The program was started because low-income children tended to be low in iron. They didn't get enough calcium. Sometimes vitamin C was a problem. So the WIC program provides supplemental foods that provide those nutritional parts. WIC started by delivering the foods. You'd get a bundle of milk, cheese, eggs, juice, and breakfast cereal. 2009, the WIC program changed the food package, and now participants still get milk, cheese, and eggs and breakfast cereal, but they also get fresh fruits and vegetables, whole grains, and a wider variety of choices on the other foods.
Now, Sarah, do folks receive these packages both prenatally and after the birth of a child?
WIC is for pregnant women, new moms, babies, and children up to the age of 5. And yes, they get vouchers that are used at the grocery stores. So there's an impact both to the family by having some supplemental foods available, but also to the local grocery stores because there's quite a bit of money in the vouchers.
And this is serving primarily low-income families?
Low and moderate. Any child or pregnant woman who has New Hampshire Medicaid as their health insurance is automatically eligible for WIC. If they don't have Medicaid, then we look at the household income.
So this is an important and critical to the well-being and future of children, obviously, but also to their families. And I really like hearing that because we were talking previous to the show, and you mentioned that it really impacts how a family eats and how they eat together and the long-term nutrition of the child, both prenatally, and you talked a little bit about breastfeeding. So talk a little bit more about some of the impact of the WIC program.
Besides the supplemental foods, WIC provides nutrition education. Each family has the opportunity to talk to a trained nutritionist about whatever subject they feel is important. picky eaters, eating family meals, eating more fruits and vegetables. The family gets to choose the topic. We support breastfeeding because that's the healthiest start for the baby and for the mom, and it impacts the whole family because if the baby's healthier, then mom and dad can go to work, care for the other children, the expenses are lower. And also it's a really important bonding for mom and baby, as well as the nutritional benefits.
And I know one of the things you mentioned is that you're finding through some of the surveying you're doing with families that people are increasing their breastfeeding time with their children.
We recently got the results of a participant survey that was done, and we're really pleased to see that moms breastfed longer than they'd originally planned. We have breastfeeding peer counselors on staff who are trained WIC moms to offer peer-to-peer support, mom-to-mom support to get through the rough spots or to find out more information or to just be there to listen.
And I know one of the things you mentioned to me was that it's not just mom-to-mom, that you have a lot of dads serving in that at-home parent role, and that you have foster parents, you have grandparents, just a number of people that you're serving.
The WIC benefits are for the child, but anybody can bring the child, any caregiver can bring the child to a WIC appointment.
And I know I was mentioning to you that I wish I had had something like that as a first-time parent, and I wish every first-time parent could have that kind of access. But it's wonderful that we do have that available here in the Monadnock region. Now, are you serving all of the Monadnock region or primarily Cheshire County?
Southwestern Community Services WIC goes to Cheshire and Sullivan counties. So in the Monadnock region, our main office is in Keene. We have sites that we go to have WIC clinics once a month in Hinsdale, Winchester, and Jaffrey. We're fortunate to have churches in Winchester and Jaffrey to host us, and we go to the community center in Hinsdale.
So it sounds like you work with community partners. Are there other folks that you work with here in the Monadnock region?
We refer to home health care's maternal and child health services to provide more support for pregnant women and new parents. Child care agencies, Head Start, other preschool. We try to encourage families to look at the whole child and not just their nutritional needs, but are they going to be ready for school? What else can we do to help them be a healthy person as time goes on?
So really important when you think about it from cradle to all the way through their lifespan to have that success in life, whether it's educationally, health-wise, certainly, and hopefully within the workplace someday. So really important, and it sounds like important for the family as well, to their both economic success and their success as parents.
We like to think so. And I think the survey results have shown that the food's important, but the other parts of WIC, the talking to the nutritionist so that they can learn healthy ways of eating and get off on a good start.
And I'm sure that's, I can remember back to with my daughter that one of the scariest things was, am I doing it right? Am I, feeding her properly? Am I breastfeeding properly? I mean, all those kinds of things. And you think back on that, and it seems so simple now, but I remember in the moment how scary it was.
You're a new mom or a new dad, or when your child grows and is doing new things, and how do we get started, and how do we keep the good things going?
Yeah, we're very fortunate to have WIC services available. Now, you also do a supplemental food program that is connected with WIC as well.
Folks over the age of 60,
Yeah.
There's the commodity supplemental food program. And with that, they get a box of healthy foods once a month. It provides things like fruits and vegetables, breakfast cereal, grains, milk, cheese.
So again, you're actually serving both ends of the spectrum.
Yes.
When we think about it. And I'm sure you coordinate with other programs that are serving that food and nutrition need in the middle there, folks like the community kitchen and some of the other services here in the
Yes.
region. Can you share with us a story maybe of someone who was impacted by receiving WIC services?
Well, I think sometimes we don't hear about things until quite a while after the child has graduated from WIC. But one recent success story was a mom who had a new baby and at home wasn't going so well, and she needed to go back to work full-time sooner than she expected. She was breastfeeding her baby and was really concerned, how am I going to get childcare coordinated and still keep nursing my baby? And we were able to help her out by loaning an electric breast pump so that she could go to work and still provide breast milk for her baby. She got through the rough patch. The baby's growing just fine, still nursing and doing wonderfully.
You just mentioned something in there that I wasn't aware of, which is that you were able to find a breast pump for someone who was in need. What kind of needs do you have as a program, and what other services, because that's really a service beyond the educational end of things and the food supplements that you're providing. You're also helping give people the tools to really be able to do what they need to do and want to do. So what are some of your needs as a program, and what other services do you want people to be aware of that you do offer?
Our program is federally funded, but unfortunately that's not quite enough right now, so we are very grateful to the Monadnock United Way for helping us keep things going on an even keel. The breast pumps that we're able to offer are provided through the state office. The things that we would like to have more of are books for children. We like to give toothbrushes and sippy cups. Those are the things that sometimes we don't have enough money for. We work with Keene State also to help the next generation of nutritionists get off to a good start. We work closely with the UNH Cooperative Extension, the programs that I mentioned earlier, HCS and Head Start.
So it sounds like you have a need for some donations of books, sippy cups. Do you ever provide clothing or anything like that to folks?
We don't have the storage space for too many things, so we refer people to the local thrift stores.
Okay. And if somebody wanted to contact you to donate something, or do you want volunteers at all?
We haven't had volunteer readers for quite a while, but that would be a wonderful thing to be able to get started again. And they can contact me at the...
Right, at WIC.
At WIC.
And so how would someone reach out to you if they either are in need of the WIC services or if they'd like to volunteer their time?
Either by email or phone number, 352-7512. WIC's extension is 4234.
Okay. And so they can reach right out to you
Same.
directly at Southwestern Community Services?
Yes, that would be the best way.
So you would be asking audience for Sarah Burke at the WIC program at Southwestern Community Services, a need to have readers for children and to have folks that could volunteer time potentially for that, and also in need of donations, things like sippy cups. And it sounds like just time is one of those really big donations that folks can give. You know, we are always honored to have programs that we're able to support through your donations, in the public's donations. And so we're thankful to have programs like WIC happening here in the Monadnock region, because they do make a critical difference in the well-being of our citizens here in the community. Are there any other things that you want people to know about WIC?
Well, the things that I like best about WIC are the nutrition education piece of it. The food helps, but helping families get off to a healthy start is really, really important, and I think that our long-term outcomes benefit.
So really, when somebody's reading, are they reading about nutrition education at all?
Sometimes.
Yeah.
We have lots of food books, like A is for apple, B is for banana, but it's not necessarily food related, because once you get a healthy start reading, you can read whatever you want.
Right. And so it sounds like, audience, that it could be just fun for you to be engaged in this and be interacting with families who would love to have your support. Sarah, we are so thankful to have programs like yours here in the Monadnock region, just making a huge difference in the early start of our children, in new parents, parents who maybe are going through it all over again and just still continue to have questions. I don't think we ever, as parents, feel like we get it just right. So I think it's so important to have that support that's provided both through the nutritional education, the the food that's supplied certainly is just critical. So I want to thank you for joining us. Want to remind the audience that WIC is out there. It's available to you. Can you share one more time, Sarah, how people would reach out to you if they're in need of your service?
They should call 352-7512, extension 4234, either to apply for WIC or to contact me or to offer support.
So we're fortunate. Sarah's provided us with another short video, and we're actually, before I end the show, it'll actually end with that video. I want to remind you that you have an opportunity to be involved, to give, to volunteer, to advocate, to live united. Please join Southwestern Community Services and the WIC program in making a difference in the families and children's lives for the future. So please stay with us as we roll a little video, and we will see you next week.